It is December 11th, 9:35 a.m. Central Time. So on this, I guess we've got rain and snow coming through Kansas and Oklahoma, headed through Missouri. So it'll be an interesting weekend. And so I thought today that I would talk about health coaching because that's pretty much what I do. And I throw the term around, but I don't really explain, I guess, what that means. So I thought what I would do is run through the benefits of health coaching, what that can do for you, and I'll share with you a study that was published by the JAMA Network, Journal of the American Medical Association network in October of 2019 on a model that incorporates health coaching at the Cleveland Clinic. Good morning, Eileen. So I put up that little graphic about all the things that health coaches kind of help you with. So your career, of course, explaining what a physician is doing. If you're working with as a health coach, if you're working with a physician, of course, the physician is the person that makes the decisions on prescriptions and diagnostics, etc., what labs need to be done, and interpreting those labs, but explaining all that is kind of in the health coaching, well, it's in the health coaching realm. So if you've ever wanted to sit down with your physician and discuss your healthcare plans and goals in detail, there are some functional medicine practitioners that have the time to do that on the very first visit, and after that, maybe not, or not as much time. It really depends on how busy they are. So the busier the functional medicine physician, the more health coaches and nutritionists and behavioral modification therapists, etc., massage therapists would be needed. One of the nice things about health coaching, nutritional coaching, physical fitness coaching is it can be done remotely. Several friends of mine are, they do that. That's what they offer is remote. Sorry, my medicine kicks in and gives me a cough. Several friends of mine are doing most of their work, especially during this pandemic, remotely. So you have access to a functional medicine model if you have a health coach, and if you have a nutritional coach, and if you have a physical fitness coach, and if you have an LPC, licensed professional counselor, that can help you manage the myriad things that cause difficulties in your health. So the first thing I want to talk about really is why healthcare really needs health coaches. And this is an article from a physician practice website from May of 2019, so it's not like hot off the press. So the whole idea is how do you successfully accomplish health care? Because really what allopathic medicine practitioners do, the standard that most everybody does is take a pill for a symptom. That pill has another side effect, and you take a pill to get rid of that symptom or that side effect. And basically you've got a chronic disease model that maintains the chronic disease. So functional medicine and going forward in healthcare is to look underneath all those symptoms and find out physiologically what is going on that's causing this issue. And if you listen to my classes enough, you're going to know that I'm going to talk about oxidative stress and inflammation as the basis of most chronic disease states. So the whole idea is if you want to get healthy, if you want to be health cared instead of disease cared, you kind of have to have a mixed bag of strategies for coordination. So a team-based care, and then that leads to population health management. So this is becoming more and more common. At which point, once it becomes more common, and hopefully it will take over the standard model of disease care, which is what we're doing in this country, then you're going to start seeing population health statistics improve. So what is a health coach? So I'm going to focus on health coaching and then I'll share with you that article from JAMA, and I may actually put it up if you want to read a journal article. Um, you can do that. So I'll find the link and I'll put it in the comments when I get done. So a health coach is a supportive member of a healthcare team, and what what the healthcare team, which was studied in this article. So this is actually a study on helping patients or clients improve their overall health through lifestyle adaptations. Okay, so many times a health coach may be a medical assistant that's in the office. Those of us that do kind of health coaching full time are doing that remote, and actually finding that it's easier, or actually more effective, I guess, to talk with someone when they're not sitting in a healthcare facility or a healthcare setting. Okay, so medical assistants, that's who I had in my office. I had two medical assistants. At one time I had a registered nurse, but medical assistants kind of got to know um, where I was headed, or if I would make a decision and implement a strategy, then my medical assistants would sit while I went to the next room and explain what I just said in simpler terms. So my background as a 30-year clinician uh, leads me to the ability to actually really explain what a physician is actually trying to accomplish, and what a physician really means by saying, okay, you have this or that condition, what does that mean? And then we talk about strategies in order to obviate that condition. Okay, so there's been studies that have shown that additional patient support or case management, really, by either pharmacists, medical assistants, health coaches, nutritionists, um, registered nurses, can have a positive impact on a patient's health. Okay, so Union Health Center in New York City, over the last 12 years, has successfully created and sustained a robust health coaching program. It's considered a level 3 patient-centered medical home. And Union Health Center believes its health coaches, all of whom are medical assistants, are succeeding in that care model thanks to the proximity to clients, so the ability to talk to them, email, text, phone calls, answering questions. There's more flexible scheduling. So scheduling with somebody like me that's remote, I'm sitting here in my dining room. So if somebody that's under one of my functional medicine practitioners has a question, they can get to me easier than they can get to the office and go through all the rigmarole that is involved in trying to get a question answered. And then standardized tracking, and then there's evidence-based communication approaches. So the Union Health Center operates in teams. And so a health coach is a member of a larger team. So true healthcare reform really requires that individual people, so those of you that are sick and tired of being sick and tired, need to advocate for yourself. And a health coach is a nice way to bridge that gap. Because you're just not going to pick up the phone and call your doctor and they're going to hop on the phone with you for 30 or 40 minutes in the middle of a busy day. Getting a hold of me and saying, hey, I have this issue, I have this concern, can you run it by the doctor? I'm sitting in my dining room. So if somebody texts me and I'm not in the middle of teaching or doing something else, then within that day, we're going to interact and discuss the concerns they have. So that's being a health advocate for yourself. So the idea is to build self-care skills and improve health behaviors and accept accountability for their own health. So it's not really about motivating people, it's about inspiring people to advocate for themselves. So the good news is a lot of physicians and even non-physician providers like nurse practitioners, physician assistants, are starting to rely on health coaches and partner with them to help connect the dots for a client's lifestyle and their care plan and their overall health care Okay, and the importance of and value of a health coach is growing exponentially. So we are facing rising healthcare costs, especially during this year, and then increasing accountability for quality outcomes. We don't necessarily get quality outcomes from taking pills, and really the whole idea behind a good healthcare strategy is to avoid having to take a medication. Certain people need certain medications, I get that. So people with seizure disorders who don't want to have seizures are going to take an anti-seizure medicine. So what we're seeing is, and this is from the CDC, more than half of the U.S. population as of 2014 has been diagnosed with a chronic medical disease. And that half, or a little bit over half, accounts for 90% of the healthcare expenditures in the United States. And there's where the health coach comes in. So working with in a physician, nurse, health coach, nutritionist, physical fitness specialist, behavioral modification therapist, massage therapist, and all that, basically shows that the reality of this data that's being acquired and talked about in this JAMA article we'll go through is that most chronic conditions can be prevented, first off, or improved dramatically for those that already have a chronic disease by eliminating some of the major factors. So you talk about smoking, you talk about exercise, you talk about stress, you talk about sleep and diet and what you're eating and what your weight is, and do you have insulin resistance, all most of those chronic diseases, not all, can be improved if not reversed. So, for 20 years, the last 20 years I was practicing, I would routinely get people off of their glyburide or metformin or glucophage or whatever they were taking for type 2 diabetes just by teaching them a way of eating, not necessarily telling them exactly what to eat, because I'm not a nutritionist, but a way of eating, a lifestyle way of eating. And you've heard the term food as medicine. A friend of mine in Dallas, every time I say that, will usually give me a thumbs up or a like or whatever. I'll interact with her and she'll say food is medicine, or food as medicine. So health coaching really focuses on the individual. It doesn't really focus on the doctor per se, although the doctor is the leader and the medical director of the healthcare team, which doesn't have to be in the same building like we talked about. So health coaching encourages the client, the individual, not the physician, to establish goals by focusing on self-management and internal motivation. Okay, so contributing to a successful outcome while working with a health coach occurs in a number of ways. So you're partnering with an individual to identify health goals. So at the end of a health coaching intake, we usually come up with a list of goals. What is your goal? That's a common question for me. What is your goal? They'll talk about, this happens or that happens. What is your goal? So we make those goals. And then the idea is to modify behavior, lifestyle, sleep patterns, all that, in order to accomplish that goal. Quite frequently, it's getting rid of fatigue and losing some weight. Okay? And then collaborating with healthcare providers, whether that be a functional medicine physician, a family physician, a nurse practitioner, a physician assistant, etc., who is busy. They're all busy seeing a number of people. I used to see about 30 to 40 a day, and then sometimes in between that I'd have to run off and deliver a baby, go to the emergency room, so people were waiting and they get aggravated, so I felt under pressure to get them taken care of. And I do think that there are times that I was not as effective as I could be because of time constraints. So basically you're helping people improve their health and well-being by taking the time to do that and collaborating with a practitioner. Okay, and then number 3, facilitating the process of lifestyle change to prevent a chronic disease or ameliorate lifestyle-related diseases to optimize overall health and well-being. And then it's providing information. So exploring and providing information, answering questions, resources, journal articles, things to read, books, etc., and referrals to the appropriate person, like a nutritional health coach or physical fitness health coach or licensed professional counselor, to help achieve that list of goals. And then supporting that person by self-empowerment, advocating for themselves, and then activating people to direct their own path of healing. You're probably not going to get healing from taking pills. Okay? So, I guess basically anybody can say they're a health coach. My background is clinical medicine. I have a medical doctorate. There are health coaching certification programs, etc. But a lot of people don't really know what a health coach is, and have never worked with a health coach. Hey, Tammy, you're having coffee, so here we go. Cheers. Coffee's actually good for you, just so you know. Too much is maybe bad for you, just like everything in life. But coffee is actually pretty good for you. So chronic disease challenging the U.S., right? There's 100 million people. 100 million, so that's 1/3 of us. And so I don't know how many of them are children, but and some children have chronic illness as well. But 100 million people having one or more chronic conditions. Okay, and that's from 2014. That's from the CDC. And so that is 90% of the nation's healthcare expenditure. Okay? And then 50% of that 90% happens in the last 10 days of life. I remember reading that statistic many years ago, when I was a medical student in a little bitty small hospital. I was doing a family practice rotation, and a 92-year-old woman came in and kept having cardiac arrest, and we had to keep doing CPR on her and shocking her and doing all that horrible stuff. And we wound up breaking all of her ribs. I mean, a little bitty, a little bitty, probably not barely 100-pound, 92-year-old. Her family, so this is in Southwest Missouri, her family was in California, and we kept trying to get them to do a do not resuscitate order, because we kept telling them, she keeps arresting, and she would come back, or, we would get her heartbeat. Well, of course, by the time we coded her, and this is how I learned CPR and how to run a code, was her, so maybe that was the point. But we wound up coding her, I think, 15 times or 14 times, broke all of her ribs, doing chest compressions and all that. It was horrifying. And finally, she passed, but not for one of us trying to keep her there for some unknown reason. So that led me to look into, okay, well, how much money did we spend on her? And it was a boatload. And so the half of the healthcare expenditures in this country are in the last 10 days of life. So making a living will and what you're willing to put up with is kind of important. Okay, so nutritional and lifestyle choices can manage chronic disease. If you listen to my classes enough, or if you came to my physiology class or my anatomy, well, mainly my physiology class, I would teach you all that. But their use as a first-line therapy has been challenging for primary care physicians, because they don't feel equipped to deliver lifestyle recommendations, despite the fact that nutrition and lifestyle are foundation for most of the healthcare guidelines, and advocating for yourself and taking accountability for your individual health. So feelings of inadequate time or time constraints, like I told you, if I'm seeing 40 patients, I get called the ER, or go deliver a baby and come back, and 15 people are in the waiting room that's been waiting for an hour, and they don't want to reschedule. So you can see where the time constraint comes up. And then nutritional educational level in medical school is just woefully inadequate. Most of the functional practitioners that I know, there's one in Columbia that used to practice in Montana. She went to Vanderbilt Medical School, and she told me that when she left Montana and opened up shop as a functional medicine physician in Columbia, she basically re-educated herself. So she redid biochemistry. She didn't go to medical school, but she got all the textbooks. She read them. She paid attention to them, nutritional science and all that. And she's a wealth of information. I mean, first time I met her, 2 hours of just shooting the bull back and forth about functional medicine and chronic disease, et cetera, et cetera. So nutritional education level in medical school is woefully inadequate. If you want to know that, you have to either take a certification or a program, or learn it yourself. Okay, and then the thing that keeps coming up is time with the patient, time with the patient, time with the patient. Moreover, chronic diseases really are not diseases, they're descriptions of symptoms, and they're descriptions of laboratory abnormalities. So if you treat patients based on symptomatology only, you're not really fixing anything. You're not really healing that person. Because like I told you, you get a medication for that symptom, that medication leads to a side effect, then you get another medication for that side effect, and then that one causes a side effect, and you get another medication for that side effect. And so many people that are around me that are even, that are older than me, I guess, feel like they spend their whole day or their whole life taking pills and taking medication. So that aggravates them. They don't like that. Okay? And then laboratory abnormalities. So if you just get some labs and make a decision based on lab abnormalities without really investigating or delving into lifestyle, stress, career, marriage, relationships, it doesn't have to be marriage, all the stuff that a health coach, the data that a health coach brings to the table, you really can't treat somebody just based on their cholesterol level. You kind of need to know, like I talked about last week, you need to know the ratios. You have to talk to the people. So many people I've talked to that are on statins, when you look at their ratios and do their homocysteine levels and myeloperoxidase levels, etc., all those markers of inflammation, they really don't have a high risk of heart disease, and they have a high risk of side effects and problems and loss of muscle and decreased coenzyme Q10 levels from taking a statin for a condition that is they're not at risk for. So I see that a lot. So, and then conventional care. So if we talk about the allopathic medical system. I talked to a physician in Michigan yesterday morning, trying to collaborate with him because he wants to start doing hormone replacement therapy as part of his program, coming out of Michigan. And he and I have kind of the same story. She's younger than me, but she gets frustrated. So you get frustrated by just writing prescriptions for this and writing prescriptions for that, and not seeing anybody really get better. And so delving into functional medicine, once again, he was the same way. He said, I got frustrated with allopathic medicine, so I started going to conferences. A4M, he goes to International College of Integrative Medicine. So he's really an integrative physician, which is a little bit different than some of what I'm talking about. So conventional care, you're just managing symptoms of a disease, so hypertension, abnormal sugar levels, but the underlying causes just aren't identified. And so, and most doctors, family medicine doctors, the guys that I worked with around in Baltimore, Missouri, they had a huge family practice. Each one of those 6 or however saw 80 patients a day. So really, how much time do you have to really gather the data you need? It's easier to just say, okay, what's the problem? Here's a prescription. See you in 3 months. That's allopathic medicine. That's frustrating for people that are trying to actually get chronic disease to go away or help people be healthier, right? So the functional medicine model of care provides an operating system that works to reverse illness and promote health and optimize function of your health, your body, your mind, your spirituality, if you will, by addressing the underlying causes, symptoms, and functional imbalance in an interconnected biologic network. Okay? So the imbalances, and you've heard me talk about imbalances in thyroid and most of mine is about imbalances in hormones, but may impair principal biological function. So you're talking about assimilating your environment, the things that come into your receptors that your brain acknowledges, defense and repair, energy production, biotransformation, your cells talking to each other, communication between those cells, communication between your conscious nervous system and what your body's actually doing, and then the impact that environmental toxins may have on you. And then, of course, we did a whole class on the microbiome, what you're putting into your intestinal factory. Well, not factory, your intestinal, what you're absorbing. So really, technically, whatever you eat is still outside your body until it's absorbed. So the microbiome helps do that, along with the digestive enzymes and the other enzymes that line the intestinal lining. Okay, so functional medicine also addresses social determinants that affect your health. So the psychological, emotional, and spiritual aspects of health and disease, that's all part of the human experience. And the allopathic healthcare system is not equipped to take care of all that. So a foundation of functional medicine is the use of food as medicine, like my buddy in Dallas likes all the time, and the to prevent, treat, and reverse chronic disease. Okay, so this study from JAMA Network at the Cleveland Clinic. So it's called the Cleveland Clinic Center for Functional Medicine. Okay, they actually did a study design, a population. They had arms for people that were in the Center for Functional Medicine and a traditional family health center at the Cleveland Clinic. So it's under the same kind of umbrella, basically. So what I want to share with you, without going through all the science, you don't want to see the statistics and blah blah and all that, and how they designed, how they were going to statistically analyze all this. But basically the conclusion is that the patients that went into the arm where they were registered with so they had a functional medicine physician as the leader of the healthcare team. They also made an appointment and were seen, well, during their appointment, their intake, they were seen by a health coach, they were seen by a nutritionist, and they were offered a mental health session if they wanted. So the support of the functional medicine model until this article, so this is October of 2019, support of that medical care model, functional medicine, has been anecdotal, so usually case reports. Okay, and so peer-reviewed evidence for functional medicine is based on specific interventions used by the model, including nutrition, lifestyles, or medications, dietary supplements, etc. So this was the first study to systematically attempt to collect data to have validated measuring and understand the association of health-related quality of life with the functional medicine model of care. So the end point was health-related quality of life. Now I realize some of that is going to be subjective, not objective, but they made it as objective as they could. So they combined measurements of weight and all that kind of stuff, but also that there was a questionnaire that was designed to measure health-related quality of life. Okay, so there are several factors that may have contributed to improvements in that associated with the functional medicine model of care. So remember, it was compared to a family health clinic versus the Center for Functional Medicine. So, so the first is that improvements in health-related quality of life associated with functional medicine with that model of care may be due to the model itself. So basically, functional medicine addresses chronic disease by delivering precision. So you're doing precision things, precise things based on the data that you're gathering from actually sitting down and having a quality conversation with somebody. So the ability to deliver that precise medicine, or I don't want to say medicine because that sounds like they were writing scripts all the time. The capability, you have to have the capability to not only collect data, but also organize it in a way that extracts an understanding of a patient's biological processes and then maps those processes for prevention or reversal of human disease. Okay? It also, precision interaction requires the ability to focus treatment around specific factors associated with a person's symptoms. So the formal definition of functional medicine, first introduced in 1991, and tracks with more recent precision medicine initiatives. So the use of the word function within the name is aligned with the evolving understanding that disease is an endpoint and function is a process. So the functional medicine model uses a systems-based approach to care that looks upstream of a person's symptoms and considers the complex web of interactions within the history, physiologic status, genetics, lifestyle, environment, relationship status, mental health status, um, career status, and all that in order to either obviate a disease process that is already established or to prevent one in the first place. So organizing that information within that operating system gives the healthcare team the opportunity to develop patient-specific management strategies to improve function through nutritional, behavioral, and lifestyle interventions. So that's where you see the benefit of the team. I don't know if Tammy's still on here. I don't know as much about nutrition as Tammy Crabtree does, and I don't know as much about physical fitness, but I do know how, especially with my ADHD brain, I do know how to gather information and put it into an organized way of presenting that to a collaborative physician, functional medicine physician, or if somebody has a family practitioner doctor that will understand the benefit of working with these healthcare teams, whether that be remotely or right there in the office. So, there are physicians that hire nutritional health coaches and LPCs and massage therapists. I've seen one that had a chiropractor, so that kind of makes sense to me. So that's a little quick primer, about 30 minutes of why healthcare needs health coaches. So there was a time where health coaching probably was going to disappear, but the it's not that old of a way of doing things, but health coaching is kind of on the upswing, especially with this remote thing and telemedicine, being able to talk to people on Zoom or FaceTime or Skype or phone or whatever device or technology you want to use. But the whole point is to gather the information so that everybody that's interacting with that person knows the same thing, and that's the beauty of a health coach. There's Crystal, LPC. So see, and then I'm sitting here in Missouri. I'm talking to somebody from Oklahoma who is having difficulty with what they eat. I've got a nutritionist. They're having difficulty in their marriage, or they got some mental health issues. I've got an LPC. So for me, it's building a healthcare team that's actually not in the same place, but we can talk to each other whenever we want. And then for me, people can get a hold of me, and I can put that all together and share that with whoever's interacting with that person. So that's my little class for this morning. I'm going to get ready for the snow that Kansas and Oklahoma is sending our way. And I have to walk the dog. I haven't done that yet. So you all have a great weekend. I have got to finish my anatomy and physiology classes. They're in finals week. So I've been kind of busy dealing with updating grade books and making sure everybody's got the right, getting the right information they need to study for their exams. So I have been on Zoom, on camera, etc. for lots of hours in the last couple of days. So anyway, have a great day, have a great weekend, and I'll see you Monday, unless I come up with something else to tell you during the weekend. See you later, bye.